Hi everyone, welcome to our Medicare and Medicaid review. My name is Instructor Oliver and I will be reviewing these two topics with you today. Many times throughout these lessons, many students who are not familiar with these two health plans usually reach out for clarity as they tend to get them a bit confused. Maybe it's because both coverages share similarities in their name, or they have a family member that participates in one of them. Or maybe, in some cases, they might know someone who participates in both. The goal of this review is to give you better insight of how both these healthcare programs work and how they differ. Please be patient during this presentation, as there might be a slight lag in displaying the slides as we move along. So with that being said, let's get started. Okay, today we'll begin this presentation by reviewing the Medicare program first. We will talk about what Medicare actually is, who would be eligible to participate within the Medicare program, cost associated, and what exactly makes up the Medicare program itself. So, what is Medicare? Medicare is a jointly funded healthcare program funded by both the federal government and the state. Medicare was implemented in 1966 under the Social Security Administration and under President Lyndon Johnson's administration, and is now currently administered by the Centers for Medicare and Medicaid Services, otherwise known as CMS. Hopefully, CMS is a term you are all somewhat familiar with. Medicare is the largest healthcare plan in the United States, and as of the year 2019, it had 61 million people who were enrolled in the program. Who is Medicare eligible? Medicare was instituted to provide health care coverage to those 65 and older. Individuals younger than 65 who suffer from a disability, and for those individuals suffering from end-stage renal disease. Those that are 65 and older are generally eligible to receive Medicare Part A and Medicare Part B if they are a United States citizen or a permanent legal resident who has lived in the United States for at least 5 years in a row. Individuals younger than 65 years of age can also qualify if they meet the citizenship legal residence requirements and have any of the following qualifying circumstances. If they have been receiving Social Security disability benefits for at least 24 months in a row, if they suffer from Lou Gehrig's disease, also known as ALS, or if they have permanent kidney failure requiring regular dialysis or a kidney transplant. This condition is otherwise known as end-stage renal disease, as you can see on our slide. Medicare. What are the different parts? So, once an individual qualifies and is enrolled in the Medicare program, they will be enrolled in what is called the original Medicare. The original Medicare only includes Part A and Part B of Medicare coverage, which we are going to discuss. So Medicare Part A, also known as hospital insurance, helps pay for inpatient care in a hospital. So a hospital admission, for example, or it'll help pay for a limited time at a skilled nursing facility following a hospital stay. Part A of Medicare will also pay for some home health care and some hospice care. When it comes to Part A, a member will usually not pay a Part A premium if they paid Medicare taxes while working during their lifetime. If they did not pay into the Medicare tax, they will be responsible for a monthly premium of up to $458 a month. The good news is that about 99% of Medicare beneficiaries do not have to pay a premium for Part A, since most of them have at least accrued 40 quarters of Medicare covered employment within their lifetime. Medicare Part A also carries deductibles and some additional charges. So for example, for this year, 2020, a member with Part A would still be responsible for a $1,400 deductible per hospital stay, $352 per day for days 61 through 90 of each benefit period, meaning if a member is admitted as an inpatient and is still in the hospital after 60 days, this $352 fee will start to accrue. Since Part A also offers coverage when it comes to skilled nursing facilities, a member will not have to pay out of pocket for the first 20 days, but will be responsible for a $176 daily charge for days 21 through 100. Anything over 100 days limit, right? The member would then be responsible for the entire accrued amount. Okay, so Medicare Part B, which is next here, is considered medical insurance. Medicare Part B helps pay for services from doctors and other healthcare providers, outpatient hospital care, home health care, durable medical equipment, some preventative health services, and some health services that aren't covered by Medicare Part A. The standard premium for Part B for 2020 is around $144 or higher, depending on the member's income. This amount increased about $9 to $10 from the previous year, and it increases every year. Every year, Medicare beneficiaries will see an increase in premium for Medicare Part B. They would pay a standard premium amount or higher if they enroll in Part B for the first time in 2020, if they do not have Social Security benefits, or if they are directly billed for their Part B premiums instead of having the premium be taken out of their monthly check, right? So if they have both Medicare and Medicaid pays their premium. And or if their modified adjusted gross income as reported on their IRS tax return from 2 years ago is above a certain amount. So as you can see with both plans, both A and B, there are premiums inclusive to them, right? So, but keep in mind that even though Part A and B coverage sound pretty well-rounded and inclusive, the coverage will typically require for the member to purchase additional secondary insurance or pay out of pocket on top of the fees we just discussed, which can be extremely stressful for most folks, as Medicare Part A and B will only cover up to 80% of the allowed amount. So, because of this, okay, next we're going to look at Medicare Part C, which is also known as the Medicare Advantage Plan. A Medicare Advantage Plan works just like an HMO or a PPO and is another Medicare health plan choice members have as part of Medicare. Medicare Advantage plans are sometimes called MA plans, and they're offered by private companies approved by Medicare. An individual joins a Medicare Advantage plan, and the plan will provide all of their Part A hospital insurance and Part B medical insurance coverage. Medicare Advantage plans may offer extra coverage such as vision, hearing, dental, and or health and wellness programs. Most include Medicare prescription drug coverage, Part D, which we'll talk about a little later on in this video. Medicare pays a fixed amount for the individual's care every month to the companies offering Medicare Advantage plans. These companies must follow rules set by Medicare. However, Each Medicare Advantage plan can charge different out-of-pocket costs and have different rules for how the person will receive services, like whether they will need a referral to see a specialist or if they have to go to only doctors, facilities, or suppliers that belong to the plan for non-emergency or non-urgent care. These rules can change each year depending on the Medicare Advantage plan, sometimes making things a bit more confusing than needed for the member. Okay. There are also different types of Medicare Advantage plans available. Some choices that might be offered to the member might include health maintenance organization plans, so plans that function like an HMO, preferred provider organization plans, so those would be PPOs, special needs plans, SNPS, or private fee-for-service plans, which are PFFSs. All right. Some of these plans may require the member to see doctors within their network in order to qualify for coverage. Others might let them see providers outside of network, but the coverage may be less. Members must make sure that when they're picking a plan, that their doctor or doctors, depending on their health issues and maintenance, participate in their carrier's network before enrolling. Basically, that can make a huge difference, especially the way Medicare Part C works. So because Medicare Part C includes Part A and B benefits, with the only exception being hospice care, which is still covered under Part A, many Medicare Advantage plans offer additional coverage beyond original Medicare. Some of those benefits might include dental care, routine vision and hearing services, wellness programs, and in some cases, even prescription medication. Um, Medicare Part C plans can also offer additional benefits such as over-the-counter medication, transportation to and from doctor's appointments, and adult daycare services. For these types of plans, there is usually a cost associated with it. So there may be different costs depending on the Medicare Advantage plan the member chooses. Some plans charge a monthly premium that the member will pay each month to be enrolled in the plan. Some of these plans can have annual deductibles, which is an amount that the member would pay out of pocket before their coverage starts. Some Medicare Advantage plans have no premiums and no deductibles, although that is rarely the case. Plan participants might also be responsible for a copay or coinsurance when they seek medical services. A copay is a set amount you pay each time you visit your doctor. This can be different at times depending on whether the member sees their doctor or a specialist. Usually when a patient sees a specialist, the copayment tends to be higher, sometimes even double of what it would cost to see just their primary physician. Coinsurance is a percentage of the total bill that the member would be responsible for paying. Since cost and coverage can be different from plan to plan, it is important that the member compares each plan carefully before choosing one. This step would ensure that they get all the coverage that they'll need at a cost that fits well with their monthly budget. Enrolling in Medicare Part C can also be a little challenging depending, as there's different times of the year when a member can enroll into a Medicare Part C plan. The first time is during their initial enrollment period, so the IEP period. This is the period when they first become eligible for Medicare. This enrollment period begins 3 months before the month that the member would turn 65. It includes their birthday month and the 3 months following. So for those 7 months, they can enroll in a Medicare Part C plan or a prescription drug plan. The second opportunity to enroll in a Medicare Advantage plan is during the fall open enrollment period, also known as OEP, which runs from October 15th to December 7th each year. During the fall OEP, they can switch from original Medicare, so from Part A and B, to a Medicare Advantage plan. They can also change from one Medicare Advantage plan to another. The third time they'll be able to make that change to a Medicare Part C plan is during the Medicare Advantage open enrollment period. This period usually runs annually from January 1st to March 31st. During this time, they can switch from one Medicare Advantage plan to another. However, they cannot change from original Medicare to a Medicare Advantage plan during this enrollment period.
Okay, the last type of coverage offered by Medicare at a premium to the member, of course, is the Medicare Part D plan. So, Medicare Part D was launched in 2006. This coverage was implemented to decrease cost of medications for people older than age 65. This prescription drug coverage has increased prescription drug use by 13% and decreased patient costs by 18% in the first 6 years the coverage was offered. Folks that are older than age 65 are legally required to have some form of prescription drug coverage. They can buy it from a company that offers Medicare Part D. They can receive drug coverage from a Medicare Advantage plan or have a prescription drug coverage from a private health plan that meets Medicare coverage requirements. Some of these companies that offer prescription drug plans would be United Health, Humana, and CVS Health. These companies covered an estimated 60% of beneficiaries enrolled in Medicare Part D for the 2019 year. So what medications would be covered in Medicare Part D? All participating plans in Part D must cover standard medications decided by Medicare. So coverage is based on what most people on Medicare are taking. So each plan has its own list of medications the plan would cover. But for the most part, most plans cover the majority of vaccines with no copay. So that's a plus for the elder. It's also important that when the member chooses a Medicare Part D plan, they should make sure that the medications they are taking are covered. This is especially important if they take specialty or expensive brand name medications. All plans generally have at least 2 medications from the most prescribed medication classes and categories. So if a doctor, for example, does prescribe a medication that is not on the list, they must explain why an exception is needed. So Medicare would require a formal letter to the insurance company from the physician explaining why the medication is required. These type of letters are normally considered a medical necessity letter. And just because the member gets one from their physician doesn't mean that they'll be guaranteed that the exception will be allowed. So each case is decided on an individual basis by the carrier. Okay. A medication plan can also change the medications or the pricing on their list at any time for several reasons. Such reasons would be a generic of a brand becomes available, for example, making the medication a lot less expensive for the insurance to cover, right? If the price of a brand changes and if a generic becomes available for that particular brand whose price has changed, if a new medication has become available, or there's new data about a new treatment or a new medication. So the different types of medications that are covered based on a category are listed here on our slide, and those would be anti-cancer medications, antidepressant medications, anticonvulsive medications for seizure disorders, immunosuppressant medications, HIV or AIDS medication, and antipsychotic medications would be included on that list. Okay, over-the-counter medications such as vitamins, supplements, cosmetic, and weight loss medications are not covered by Medicare Part D. So other prescription drugs that wouldn't be covered by Medicare Part D would also include those listed here on the slide. So those would be fertility drugs, medications used to treat anorexia or other weight loss or gain when these conditions aren't part of another diagnosis, medications that are prescribed solely for cosmetic purposes or for hair growth, medications prescribed for the relief of cold or cough symptoms when the symptoms aren't part of another diagnosis, or they wouldn't cover medications that are used to treat erectile dysfunction in men. So that takes care of that. Okay, so moving forward, as we discuss, there are a lot of different plans that the member can choose from. Okay, and yeah, the member would just have to pick the right plan for them. So now we are going to move forward and we are going to discuss Medicaid. So we're going to look at what Medicaid is, who is Medicaid eligible, what services are included in Medicaid. So let's dig in. What is Medicaid? Okay, so Medicaid, unlike Medicare, is a jointly funded health insurance program funded by both the federal government and the state. Medicaid and its rules are individually crafted depending on the individual state, as long as the states follow the federal requirements. This type of health plan was created to help those in financial need to receive needed and necessary medical services. It has assisted many low-income and needy families and children throughout the years. So, who is Medicaid eligible? Individuals who are eligible for Medicaid must meet certain criteria set by each participating independent state. Income, family size and status, disability, and other factors may vary from state to state. But in essence, those who qualify would be low-income families. Each state has its own threshold of what the maximum income an individual couple may have in order to qualify for Medicaid. Since each state has authority over the eligibility requirements, monthly income requirements differ from state to state. So for example, an individual would have to meet a certain monthly income to qualify for Medicaid in my home state of New Jersey. An individual's monthly income must be below $1,063 a month. A couple would only be allowed $1,437 a month. In comparison to the state of New Mexico, an individual's monthly income would have to be under $783 a month, $1,175 for a couple. This shows how different the financial qualifications are from state to state. Others that would qualify would also be needy children, pregnant women, the elderly, and people with disabilities. Once an individual qualifies for Medicaid, they will receive a card and benefits that can be used like any other health insurance coverage through any other insurer. Medicaid can be an individual's only coverage, or it can work in conjunction with another plan, including Medicare. Federal law requires that Medicaid be considered the payer of last resort. This does not mean that services will not be covered or that a member can't rely on Medicaid for coverage when needed. It just means that Medicaid will pay after any other payer has paid its share of the services provided first. So an example can be if a person has Medicare coverage or any other type of private health coverage, Medicaid will always be the secondary payer. The doctor or healthcare provider will bill the primary payer first, and Medicaid will then consider the claim and may pay any balance due after the primary has paid. Okay, so what is covered under Medicaid? So Medicaid covers a wide range of medical services, such as services such services as inpatient hospital care, physician office visits, outpatient hospital or clinic care, diagnostic services, pediatric services, and even transportation for medical care. In some cases, depending on the need and at a premium or a small co-payment, that the member would have to pay, some Medicaid programs will also offer optional medical coverage. This coverage can include services such as chiropractic care, prescription drug coverage, therapies such as physical therapy when medically necessary, eye exam and even eyeglasses, and dental services. However, there are certain healthcare services that Medicaid will not cover, and those would be medical services outside of the United States, cosmetic surgery, over-the-counter meds, and things like supplements. So those things they would not cover. Medicaid also covers medical care if the service is provided by a participating Medicaid provider, but because Medicaid does not reimburse doctors and other healthcare providers at the same rate as private insurance, many practitioners opt not to see patients who are covered by Medicaid as their only coverage. Okay, so this wraps up our lesson on Medicare and Medicaid coverage. Hope you all enjoyed it, and thank you all for joining.